I'm here at the NCRI conference to talk about my work using PARP inhibitors, which are a novel group of compounds traditionally used to treat women with breast cancer, with a very specific form of breast cancer. What my work shows is that perhaps these drugs have a wider application, and specifically that they may be used to target cells in low oxygen conditions, which would apply to a much broader range of tumours. Hypoxia occurs in the vast majority of solid tumours, and what that means is that there are cells in those tumours which are existing in low oxygen, so lower than your cells would normally be exposed to. Our hypothesis comes from our findings that hypoxia down-regulates the DNA repair pathway, so it down-regulates the mechanism by which a cell usually repairs itself. The PARP inhibitors have been shown to be very effective against cells which have these DNA repair pathways mutated usually. So what we've done is put these two things together and shown that in cells which have down-regulated these pathways because of the low oxygen condition, they are also sensitive to the PARP inhibitors. So it's a new use, a new application for a drug that's already been tested. Realistically, we're just at the beginnings of this research, but the relevance and the exciting thing about this is that this is a group of drugs that have already been tested, they're already in the clinic, they've already been shown to have very little side effects, and what we're suggesting is that perhaps they have a wider application. So instead of just being aimed at this one specific group, then perhaps they could be used to treat a much broader group, and also perhaps in combination with other current therapies.